I'll talk about diabetes and rice today. First thing a diabetic is told by any doctor in South India especially is to stop eating rice. It's also common in other states. Even in North India, they say rice is bad, so they say you should eat wheat. In a few places they say wheat is bad, but most of the time in South or North India also they say rice is bad for diabetic patients. But we should know that rice is the staple diet for Asian Indians, entire east, entire south of India. People eat rice they have been eating rice for last some 10,000 years. It's not a recent phenomena. People have been eating rice. But there are pockets like in Deccan Plateau, in some of the areas people have been eating different cereals, not rice. They have shifted to rice. So, but these things happened last 100 years. So, in very small pockets of India, people have not been eating rice and they have been eating different cereals and they have shifted to rice. But otherwise, a staple diet in most of the places in India is rice. And it's also easier to grow. It's also easier to process and easier to cook. So, people have been used to eating rice, cooking rice, making different things with rice. And diabetic is now threatened that by eating rice he gets bad complication or control of diabetes is bad. That's not really true. You can't change your dietary habits which your families have developed over hundreds of years. Suppose for 1 or 2 generations or 2 or 3 generations you have been eating rice, please continue eating rice. If your forefathers, if your grandparents have eaten jawar or something else, you please continue with whatever they have been eating or whatever you have been used to eating in your childhood. So, it all depends on from which area you come. If you are from coastal area, from Godavari districts, you better eat rice even if you are a diabetic. If you are from Rayalaseema and other places, okay, if you are used to eating ragi and all such cereals, you please continue eating ragi. You don't have to shift from ragi to something else. Similarly, if you are from Telangana area and if you are eating something like jawar or whatever you are used to in your childhood or whatever your parents or your grandparents are eating, it's fine. But if you are a rice eating family, if you are from a rice eating family and if you are used to eating rice, please don't shift from rice to any other cereal. That's very important. Don't think that rice is bad. Yes, if by polishing rice you are losing some of the nutrients, that is fine, you are losing some nutrients. Hand pound rice is better, but you can't always get hand pound rice. So, you don't have to struggle a lot and take a lot of efforts to go and get hand pound rice and then try to eat hand pound rice. It's fine if you get it. If you don't get it, polished rice is also okay. Similarly, some people who are told that you have to eat parboiled rice. Parboiled rice is what you get in Kerala and Ceylon and some of the southeast countries. If you are not used to eating parboiled rice, you don't have to eat parboiled rice. But it is true that more than polished rice, hand pound rice is better, and parboiled rice is much better than hand pound rice. But it doesn't really mean that you have to eat one of these unpolished rice or parboiled rice for making your diabetes better. Please continue eating whatever you are used to, whatever is available, whatever you have access to. That's more important. You can't just go on searching for different types of rice. Nowadays there are also people who are selling low calorie rice. It's not really true. Rice has got about 70-80 calories. Sometimes they say there are different varieties of rice which do not cause diabetes or which are good for diabetes. It is not true. There are a lot of diabetic rice brands available in the market. It's not really worth trying all those things. If you want to use it, you can use it, but there are no really such thing as low calorie rice. Whatever rice you eat, once you boil it, it becomes easily digestible, and whatever rice you eat, 80% of it has got calories and it is digested quickly. You are not eating rice raw, you are eating rice after boiling, so it becomes easily digestible and so the blood sugars start rising quickly within 1 hour. It's okay, fine, let the blood sugar rise for 1 hour or 2 hours, let it be, but it is not harmful. Please don't think that rice is bad. Once you boil, whether you are eating low calorie rice or normal rice made available in the market, it's the same. You get the same sort of blood glucose levels after you eat it. That's one thing. Then a lot of material, scientific material that has been published recently against rice. People published from United States, people published from Germany, people published from France. These are all the countries where people do not eat rice, they eat wheat or some other product. And if those people are given rice and you publish a paper based on eating rice among populations who are not used to eating rice, that is not applicable to Southeast Asia, not applicable to India, not applicable to China, not applicable to Japan. And to be more sure about that scientific literature, about 30 years back, we didn't have so much of diabetes because we were all eating rice. India didn't have so much of diabetes. China didn't have diabetes. Japan didn't have diabetes. We were all eating rice. Entire Southeast Asia, diabetes was a rare disease. Diabetes is more common in Western population in those days. But today, because our food habits have changed and we are eating a lot of non-rice products, or at least cereals which are not used to be taken by us. Something like oats. Suppose if you are taking oats, we are not oat eating population. Suppose if you are eating oats, you are more prone for developing diabetes because your body will absorb sugar in a different way, not like rice. It cannot adapt itself. For 1 or 2 generations, it will take time for us to adapt to oats or quinoa rice. Quinoa rice costs about 2,000 rupees per kilogram. And now people are buying quinoa rice in India and trying to eat quinoa. Quinoa is a little similar to thaidulu or korralu of South India. So if you are used to eating korralu, you better eat korralu. Don't buy quinoa rice. Quinoa is something imported from Bolivia or from South America. So by eating quinoa rice, please be sure that you are increasing your blood sugar and not decreasing your blood sugar. If you eat any cereal which you are not used to, you are actually harming your body. Your blood sugar will rise. That's very important. Don't ever think that whatever your parents or grandparents have been eating is bad for you. It is good for you. Even if the textbooks write against it, even if the media tells you against that, if the scientific publications they tell against that, please eat whatever your parents and your grandparents have been eating, and please eat what you are used to eating in your childhood. That's more important. A diabetic need not change the cereal what you are eating. If you are rice eating person, please eat rice eating person. Please continue to be a rice eating person. So don't ever blame rice, which has been a staple diet, which has given us life for several generations in our parts of the country. Today we had a few real things about diabetes. It's important that you should know more about diabetes, the real things about diabetes, and don't be carried away with a lot of misconceptions and misbeliefs. I hope I made myself clear to you. Next time we will have a different topic with different ideas.